What separates CFS from other fatigue conditions? Imagine feeling exhausted all the time, but in a way that's much more than just needing a good night's sleep. Chronic fatigue syndrome, also called myalgic encephalomyelitis, is a complex condition that affects many parts of the body, not just your energy levels. It's different from regular tiredness that most people experience after a busy day or a sleepless night. In common fatigue, resting usually helps restore your energy, but in CFS or ME, rest often doesn't fully relieving symptoms. One of the key features that sets CFS or ME apart is something called post-exertional malaise. That means if you do even a little more activity than usual, you might feel worse afterward. Sometimes this worsening happens right away, but often it's delayed, and it can last 4 days or even weeks. This is not typical in other fatigue conditions, where rest usually helps you bounce back quickly. The fatigue in CFS or ME is also much more severe and persistent. It doesn't go away with sleep or rest and can be so intense that it stops you from doing things you used to enjoy or need to do. Usually, this fatigue lasts for more than 6 months and is a new or clearly defined onset, meaning it's not just a gradual decline but a sudden change in how you feel. Many people with CFS or ME experience what's often called brain fog. This includes problems with thinking, memory, and concentration that are more noticeable than in typical tiredness. It can feel like your mind is cloudy or slow, making it hard to focus or remember things. Sleep disturbances are also common, but they are not just regular insomnia. Sleep may be unrefreshing, or you might have trouble falling asleep or sleeping too much, which adds to the overall fatigue. CFS or ME often involves multiple systems in the body. Besides fatigue, people may experience widespread pain, headaches, muscle and joint aches, and flu-like symptoms. Some also have issues with their autonomic nervous system, which controls things like blood pressure and heart rate, leading to symptoms like dizziness when standing up. Research suggests that CFS or ME involves neuroimmune dysfunction, meaning inflammation in the brain and nervous system. This neuroinflammation is a key difference from other causes of fatigue, which usually don't involve immune system changes in the brain. Because of this complexity, diagnosing CFS or ME isn't straightforward. There's no single test for it. Doctors look at symptoms, rule out other causes like sleep disorders, anemia, thyroid problems, depression, or anxiety, and use specific criteria. The Institute of Medicine recommends that a diagnosis involves fatigue plus post-exertional malaise, unrefreshing sleep, and either cognitive issues or orthostatic intolerance, which is difficulty standing up without feeling dizzy. It's also important to understand that fatigue in CFS or ME is not just a simple feeling. It's multidimensional, meaning it affects different aspects of your health and is qualitatively different from fatigue in other illnesses or in the general population. It's a complex, multi-system problem that involves the nervous, immune, and energy production systems in the body. In summary, what makes CFS or ME stand out from other fatigue conditions is its unique combination of symptoms, especially post-exertional malaise, cognitive dysfunction, unrefreshing sleep, and multisystem involvement, along with evidence pointing to neuroimmune dysfunction. Recognizing these differences is essential for accurate diagnosis and appropriate management. If you suspect you might have CFS or ME, it's always best to consult a healthcare professional who can evaluate your symptoms thoroughly and guide you toward the right care.